Hello, welcome. Today in this short video, we will expand on our discussion of Tetralogy of Fallot and consider what happens when tetralogy is associated with pulmonary atresia. We've made this video specifically to discuss something that's often particularly difficult to understand, and that is the major aortopulmonary collateral artery, sometimes called MAPCA. This is our virtual theatre which we've made to help me to present these videos. And this is my friend Ed, the avatar, who helps me to describe the different lesions. Now before we start, I would like to remind you that this video is for general information only. Please don't use it as a source of specific clinical information about the care of your individual child. I'm sure that you will discuss any specific questions about your special child with your healthcare team. So let's start. First, it's probably useful to consider what happens in the normal circulation. You might want a brief refresher course on this from our video in this series about the normal heart. And I would also recommend that you spend a few minutes looking at the video on Tetralogy of Fallot. Briefly, the video on the normal heart shows that the blood, which is low in oxygen coming back from the body, is pumped through the right side of the heart into big arteries, which transport this blood to the lungs. These big arteries are called pulmonary arteries. The word pulmonary means related to the lungs. In Tetralogy of Fallot, there's a large hole between the two ventricles, a ventricular septal defect, and there is narrowing under the pulmonary valve, restricting flow into the pulmonary arteries. The term Tetralogy of Fallot with pulmonary atresia refers to a situation in which, in the setting of Tetralogy of Fallot, the narrowing below the pulmonary artery is so severe that it is completely blocked. And in patients with tetralogy and pulmonary atresia, there is often underdevelopment of the pulmonary arteries themselves, so much so that sometimes they are almost impossible to identify. When patients with pulmonary atresia and tiny pulmonary arteries, blood gets to the lung in another way, and this is through large or major, extra or collateral arteries that come from the aorta and are distributed to the lungs. Hence the name major aortopulmonary collateral arteries. MAPCAs. There is a wide variability in the size of the pulmonary arteries in this condition and in the distribution of the MAPCAs, and so equally the exact procedures that are performed on an individual child will also vary. But we thought that it would be useful to provide some general principles and types of procedure that are common. We wanted to focus on a particular procedure which is often difficult to understand, and that is the procedure known as Unifocalization. Simply put, this is a technique in which a surgeon gathers all of the multiple vessels going to the lungs together into a single source. Sometimes this unifocalization may have to be done in stages on each side. Once a unifocalization is complete, the surgeon can then sometimes at the same operation close a ventricular septal defect and put a valved tube or conduit from the right ventricle to the unifocalized pulmonary arteries, a so-called single-stage procedure. But sometimes after performing the unifocalization, the surgeon puts a tube from the right ventricle to the pulmonary arteries, but leaves the ventricular septal defect open, and sometimes the surgeon provides blood to the unifocalized pulmonary arteries through a tube from the aorta. In both of these circumstances, the surgeon will return to close the ventricular septal defect and put a valved conduit from the right ventricle to the unifocalized pulmonary arteries at a later procedure, a so-called staged approach. It's important to emphasize that the decision-making must be tailored to a particular patient by the treating team in collaboration with the patient's parents. It's definitely not a one-size-fits-all, And it's not always that a single stage procedure provides the best outcomes for an individual child. So it's important that you work with your child's treating team, as together you find the best care pathway for your precious child. Please remember that irrespective of the treatment pathway chosen, we continue to recommend lifelong care for all patients after this procedure. We hope that you found this video informative, and again, thank you for your attention.